All right, are we live? Are we live? Thank you. All right, the Arlington County Board is now in session, our virtual special meeting for March 30th. And we have with us my three board colleagues remotely, Christian Dorsey, Ms. Katie Crystal, and Matt DiFerranti. And we have our manager who will start us off talking about the governor's order that was just issued an hour or so ago. Mr. Schwartz, I turn it over to you.
Thank you, Madam Chair. At 2 o'clock today, the governor issued Executive Order number 55, which is entitled Temporary Stay-at-Home Order due to the novel coronavirus. And we are about to send out some guidance on that, explaining what is included in there. And at 5:45 p.m. today, people who are subscribed, actually, I don't think it's everybody in Arlington will receive a wireless emergency alert. That's where your phone's going to vibrate, and it's going to provide all the information to you related to the order with a link. And I'd like to emphasize again that what the governor's order does is it re-emphasizes the importance of staying home, and there are some exceptions there for buying food, caring for family members seeking medical attention, going to work if you have an essential work assignment, and also continues to allow volunteering for a nonprofit. One thing that it drives home, which is incredibly important, is wherever you are to maintain social distancing guidelines of 6 feet apart, and that is incredibly important. I would say that we have been practicing most of these approaches already. We did see, unfortunately, over this past weekend, a number of groups congregating in our parks, and some people went so far as to even take wire cutters and eliminate locks from the parks and hop over fences and basically disregard some of the social distancing. This is very important that people follow through on it, and the executive order will be online with a link through the wireless emergency alert and also on our website.
Thank you, Mr. Schwartz. I think you have some of your staff here. Perhaps I'll see if my colleagues have any questions for you at the moment, and then I believe you have some staff on hand to do some briefing for us, Mr. Schwartz.
Yes, available to answer any of your questions related to not only the executive order, but also the status of our healthcare system, the hospital surge capacity, and then our approach to food distribution. Dr. Ruben Varghese is on the line, also Jim Schwartz, Deputy County Manager, and then Aaron Miller will be joining us shortly. He's participating in 2 other phone calls simultaneously. So if you have questions, Ruben and Jim are available.
All right, thank you very much. I wonder if colleagues, if you have questions, but I might invite Ruben, Dr. Varghese, to give us just a little bit of an update about how things are going at Virginia Hospital Center. Bring us a little up to date. Is that something you can do, or should we go right to questions?
I can absolutely do a update. Thank you, Madam Chair. I hope you can hear me. So once again, I want to put context. We have community-wide spread in the region, and that is the assumption everyone should have. With our unfortunate announcement of deaths in Arlington, it's a reminder that this virus is real, it's going to affect people, and we need to maintain the social distances that have been doing, and this governor's order is going to be very helpful to hopefully plug up any last remaining holes. What I'd like to report is, we are up to 100 positive cases in Arlington, and we're only going to see that continue to rise. Obviously, there are people who are hospitalized, and they're not all at Virginia Hospital Center. It's one of the things that people need to understand. Our healthcare system in the National Capital Region is actually an integrated system. So there are people going to be hospitalized throughout the region that may be Arlingtonians and people in Virginia Hospital Center who come from other jurisdictions. The system is working at the present, and I can tell you what's going on at the hospital for their surge capacity planning, which hopefully will be reassuring for some. First of all, on infection control, the hospital has been working with us very well to make sure that they're able to adhere to the best infection control practices so that as they are a center where there's more exposure to the COVID germs, obviously because it's the funnel point for our community, they're working with us very well and taking the precautions that are necessary and letting us know if they have any concerns. Their present capacity for beds and ICU beds has not been exceeded, and they're preparing for hospital surge. They have been working on engineering workarounds to convert spaces to more critical care space. So, for example, one of the best ways to be able to remove germs from the space is to have negative pressure, basically to suck the air out of the room, out to the outside world. And they have actually converted the whole tower. They've been able to re-engineer it and test it to be able to see that the negative pressure can be done in that building, so that if they need to convert that space into ICU sort of capacity, they'll have that ability. It aids with reducing germ contact for the staff and the patients. Likewise, they've applied for modifications of their certificate of public need through the Virginia Department of Health to help convert their NICU, the neonatal ICU, to an ICU and another critical care unit to a medical surge unit. So they are being very creative, and VDH has been helping them to have that, and it's going to be what other hospitals in the area are going to do. Is the more that they can retrofit their existing resources to respond to the need, and they're going to go back and ask for more modifications, including their physician's office buildings, because they do have those assets on campus. So I think we can be rest assured they're trying to be as creative as possible to maximize the capacity at the hospital in new ways. So in addition, they've gone from 50 collection units per day for the testing protocol at the Buck property to 100 Monday through Friday. So that's another additional good thing that they're able to do. And for based on their relationship with the Mayo Clinic, their turnaround time for labs when they send it through the Mayo Clinic is 36 hours, which is quite good. Obviously, it's not ideal for the whole community, but that's a great resource, and the fact that more places are coming online, hopefully we'll get more testing, but the lab testing capacity itself is going to be an issue for a while. That's where I'll end my briefing.
Thank you very much, Dr. Varghese. And then, colleagues, if you're all right, I think I'll go to Deputy Manager Jim Schwartz and Aaron Miller, if he's able to join us, and then see any questions that we might have for the whole team. Is that all right?
Yes.
Hearing no objection.
Yep.
Thank you. All right. Mr. Jim Schwartz, Deputy Manager, you want to fill us in on, I guess, regional issues?
Yeah, thank you, Madam Chair. Just to add on to what Dr. Varghese was briefing about regarding the nature of the hospitals and their working together across the region, the Northern Virginia Hospital Alliance is coordinating the activities of all of the hospitals in Northern Virginia. They are working to essentially aggregate all of the surge capacities. The hospitals in Northern Virginia estimate that their surge capabilities can be 76% above their normal licensed bed capacity. So that is fairly significant. It also, the Northern Virginia Hospital Alliance is also working with authorities from the federal and state government who are looking at the possibility of alternative care sites. These would most likely be for non-critical COVID patients where the numbers might exceed what the hospitals on their own properties are capable of dealing with. So these facilities would be not that we haven't yet, there are a couple of locations in the Northern Virginia region that have been evaluated, but no firm decisions have been made as to where those sites would be. And they're still working on staffing and equipping those sites because, as you can imagine, the hospital's staff will all be concentrated on their own facilities for their surge capabilities. So things are in motion throughout the region, and as they develop, we'll be sure to keep you informed.
Thank you very much. And is Aaron Miller on the line? I'm guessing he's not.
Not yet.
All right, colleagues, any questions right now for Dr. Verghese and either one of our Schwartzes?
So I appreciate the update. I have one, but I want to start with just a thank you to Dr. Verghese, Mr. Manager, and the Deputy Manager, Mr. Schwartz, for all your work on making clear it's a regional challenge, and also the surge capacity comments that you had specific to Virginia Hospital Center. My question is about outside, in light of what you mentioned, Mr. Manager. And, you know, I've been, when I go outside, I've been heading more towards the side of, carefully along the side of the road than on the sidewalk to keep that 6 feet distance. But as you're outside, everything I've read, you're not in the same situation as inside in a room with respect to your risk, but there is still significant risk. And there's articles that are out there. I wondered if you could sort of try to broadly describe what the concerns are. Of course, we don't want the things that happen on Sunday in some instances to occur, but we neither want to have folks be overly terrified on outside, but also nor do we want people to be too cavalier, as we saw in some instances on Sunday. So can you give a little sense, Dr. Verghese?
Sure. I think the thing that we have to focus on is whether it's inside or outside, the 6 foot distance is really what we need to focus on. Okay, it's how disease is transmitted. Is the risk a bit lower? Sure. This is not the time to play with margins here. If we're going to be doing a stay-at-home order, we've got to realize that we've got to stop germ transmission as much as possible. We're encouraging people to exercise responsibly because it's also important for their own mental health as for their physical health. However, we need to realize we're not taking this lightly, and so 6 foot distances are important in all of these settings at this point, and so that's how I would answer that question.
Great, thanks. I'm glad you reemphasized the context of only for specific exercise needs to even be outside, but I wanted that context. Thank you.
Okay.
It's a good question. Thank you, Matt. We're hearing that kind of question a lot from folks. Ms. Crystal?
Oh, great. Just coming off mute. Thank you. I wanted to follow up on the query about the hospital, or the information about the hospital reallocating or redesigning existing spaces for more surge capacity. I know one of the things that remains of interest to a lot of us in the community is what happens to people who are in need of medical attention for reasons other than COVID-19 during this crisis. And is that being handled regionally as well in terms of the sort of usual functions that Virginia Hospital Center may be delivering, or the type of patients they'd be caring for under normal circumstances? Will those needs be met at other facilities? Is there an effort to sort of divide wings of the hospital? In general, any insights you can give us in terms of balancing other medical needs of an emergency nature in the community?
Sure, happy to start with that, and maybe one of the Mr. Schwartzes can follow up with a regional. So the context really is they've stopped doing elective procedures or surgeries at the hospital. So, and that's, I believe, now throughout the region, which is quite appropriate for this. However, having said that, they do have the capacity to deal with all emergencies at this point. So they're not saying it's only COVID or it's only heart attacks. It's going to be whatever is presented to them, and they're taking the precautions that are appropriate to assume that, unfortunately, a person with a heart attack could also have COVID. So those are the things that we have to remember in that, and remind public. Our hospitals are working to make sure that they can actually respond to emergencies in our community, COVID or non-COVID related. So they will, they're designing these areas to be able to concentrate people with, say, COVID if it was necessary, but that doesn't mean they aren't going to be taking care of other needs as well. But that's going to be what we are not going to be knowing until actually we're seeing what happens, how they have to allocate resources. If they're all full in one area, they may have to divert, which happens routinely, to other facilities that may have bed capacity. Those are things we can't predict yet.
Ms. Crystal, does that answer all your questions at the moment? Okay,
Yes, thank you very
Yeah,
much.
Yeah, thank you. Mr. Dorsey?
Thank you, Madam Chair. I just wanted to touch on the governor's executive order from today, which, as Mr. Schwartz noted, doesn't really break any new substance. It just clarifies pre-existing executive orders while also reinforcing the social distancing guidance that Arlington County has been putting out for several weeks. But it does add to it class 1 misdemeanor consequences for people who do violate it. And I'm curious, Mr. Schwartz, you've thought about what you want our citizenry to do in terms of reporting any instances where they see the spirit or the letter of the executive order being violated. I would imagine we don't necessarily have the capacity to go out and police this everywhere in the county.
Thank you, Mr. Dorsey. Over the past weekend, a number of people who witnessed what I'll call poor social distancing called into our emergency communications center, and that is something that actually takes away from our capacity to respond to true emergency calls. What we are asking people to do is call the non-emergency police number, 703-558-2222. And those calls actually can be handled by people outside of the ECC. We've set up a way to do that. We also have park rangers and park rovers available at many sites. The other thing where I would hope we also could have our residents do is just gently remind their neighbors about the best way to comport themselves publicly, because it's always been my view that peer pressure, gentle peer pressure, not overt peer pressure, is the most effective way in modeling behavior, because we cannot be everywhere to make sure that people are behaving. And our approach still will be to warn people rather than bring the hammer down of them on a class 1 misdemeanor, which has a significant financial penalty with it. But if people continue to be recalcitrant, then we will be faced with no choice. And we've actually had the police come out a few cases, and we really would like to avoid that, because our police department and our first responders have been stressed measurably by the current circumstances.
Thank you.
All right. Any further questions? See if I've got hold on, my volume is not doing right. Mr. Dorsey, any further questions?
No, Madam Chair. Thank you.
Okay, thank you.
So, Madam Chair, I did
Yes,
want, since Aaron Miller is not able to get on, I wanted to give just a very quick update on food distribution.
Thank you.
Which is, the information is available on our website and also on the Arlington Public Schools website. Last week, we moved to 5 schools that are doing distribution, and Key and Barrett were the first 2. Key and Barrett were added to the first 3 that we had. And the first 3 escaped me at the moment. I'm sure other people on the call will know. And we're working right now to make those people who are not within walking distance of those schools, make available for them transportation from where they're at to those sites as a way to distribute food. Schools is looking at what they're moving into. They want to move to a weekly distribution model as they head into spring break, where they'll be handing out food for an entire week. That's some of the details, and that still need to be worked out. And we're also working with some outside groups to set up an opportunity for people who cannot get out of the house to phone in and ask for assistance. And we will update the community as soon as we have some very specific details on that.
Thank you, Mr. Schwartz. Can everybody hear me all right?
Yes.
Yes,
Yeah.
you can. All right, good. I'm having a little volume control issue with my machine. Thank you, Mr. Schwartz. Does anybody have any question about food distribution? I had one question more about regional surge capacity, but I'll check first to see if anybody has any questions about food distribution at this point.
Not on food.
Everybody good? Okay. Mr. Jim Schwartz, are you able to give, I guess it would be a range of time that should, once things are kind of set for a regional surge capacity, the site is picked and at least there's sort of an agreement that we need to move forward, and we decide to move forward, how much time will it take to get that up and running? I think the personnel, the staff, it is a different issue, but at least the physical facility, can you give us an estimate on how fast that could happen?
I don't know that I have a firm estimate, Madam Chair. It'll all depend on what are chosen as the sites. Some of the sites under consideration are buildings with, I should say that the kind of care that's envisioned is referred to as arena style care. People may be familiar with old pictures from the Spanish flu where you have lots of people in a big open space. So those are the kinds of spaces or facilities that are being considered right now. Some of them are existing facilities. Others could potentially be tents, large-scale tents that I think people may be familiar. I'll use the word MASH, but it's not really a MASH unit. But they're all field hospitals that can fill that kind of a need. And we are also in conversations with the state about the possibility of using hotels. I think the board is familiar that a couple of hotels have at least temporarily closed in Arlington. And so, we have surfaced with the state the idea of using perhaps those facilities, again, for these non-critical COVID patients that need medical care, but they don't need the critical care that Dr. Varghese was describing before. So I'm sorry that I don't have more for you on the timeline. We may have more tomorrow as the Hospital Alliance is briefing the regional chief administrative officers. There may be more developed by then.
Thank you very much. I appreciate that. I'll probably ask that question every day, just letting you know. All right. Any more questions for any of our team on this before we move to our first agenda item?
Well, I did have one
Mr.
more,
DeFranci.
which is just, I assume that this is for Jim Schwartz again. I assume that, both with respect to patients, I know tonight at 8, we're going to be, I believe it's 8 o'clock, we're going to be trying to just give a clap outside our windows or try and recognize healthcare workers. And I really want to just mention that with respect to today as well, because I did, from afar and before the governor's order, I did drop by a couple of the food distribution sites, and it was great to see folks being very safe in the county police department there. And so just wanted to sound that note of thanks. And then just to confirm, unless, Jim, you have anything additional to say, that I think that there's an effort both with respect to our healthcare workers and our first responders in this crisis generally to see if we can make sure that they're protected if there's hotel space available. Is that something you're still working on? We
are still working on it. That has to do with situations in which some of the first responders that have to come to work, but may have concerns about carrying the virus home to their families. So they may not have been identified as yet as having the virus. In those circumstances, we would take the isolation and quarantine actions that you've heard so much about. But there are some circumstances in which we are looking at the possibility of making hotel space available to some of the responders who are just trying to be extra cautious about their families. We'll also look at hotel space if we have to go to our own surge capabilities with our public safety departments. And so as an example, with the police department, if Chief Farr's personnel resources were reduced by a significant amount, the police department would go to 2 shifts, 12 hours each. And when that occurred, he would offer hotels to some of his officers who live far away so as to reduce the commute time. And then he would work the schedules out so that people would be on and off for a period of time and then get a longer break. So just it's something to put in our arsenal of resources and be flexible with our own workforce.
Thank you. I just think it's important for everyone to hear all the planning that you're doing and that we're doing as we're all worried about our health, thinking about those who are keeping us safe and making sure we recognize and plan to keep them safe is also important. Thanks.
Thank you.
Thank you. All right. Anything else for the team, or shall we move on? I'm going to Here, if I don't hear any objection, we'll move on to our first agenda item. And is our clerk, Ms. Jacobs, are you there to call the first agenda item?
Yes, I'm ready.
Okay,
Consideration of fiscal year 2020 grant agreement between the County Board of Arlington and the Virginia Department of Rail and Public Transportation for use of Commonwealth transportation funds.
thank you. I think we'll take, we already take that,
Yes,
Mr. Schwartz, and then we'll come back to the other one.
Yes, Jason Fries is online and has a brief presentation.
All right, Mr. Fries.
Yes, good evening. Can everybody hear me? Great. Madam Chair, members of the board, my name is Jason Fries. I am with the Department of Management and Finance. And what I have before you this evening for consideration is, as mentioned, the subject approval of a grant between the County Board and the Department of Rail and Public Transit for emergency funding to fund our local transit operations. As you know, the governor's issued an executive order. Many people are staying home, and this has severely impacted the revenues on the local transit operations in Arlington on our ART service. So the Department of Rail and Public Transportation has approved funding for all transit operators statewide equal to 1 month of the lost revenues during this pandemic. So we have been approved for $420,926. So this is requesting approval of that grant and appropriation of the funding. That's it. So with that, I'll open it up to any questions the board may have.
Thank you. I think I'll turn first to Ms. Crystal, who's been kind of spearheading this for us, I think. Ms. Crystal?
So thanks very much, Madam Chair. I'm ready with a motion if you and my colleagues are. Beyond that, I'll just say my sincere thanks to both the Department of Rail and Public Transportation. I think this was possibly the swiftest relief we've seen from any level of government, certainly from the state, to get this additional allocation of funding available to support our transit operators throughout the Commonwealth. And I really also want to thank our staff for prioritizing getting this done quickly so that we can get this emergency relief money for our ART system through the door.
That's great. Please make a motion.
Okay, great. So colleagues, I move that we approve the attached grant agreement dated yesterday, March 29, 2020, between the board and DRPT for the use of Commonwealth transportation funds for funding support for transit operations, that we further authorize the county manager to execute said agreement and execute, if required, a letter to DRPT with further details. And finally, that we appropriate $420,926 in fiscal 2020 DRPT operating funds to the Department of Environmental Services.
Great. Is there a second?
I'll second.
All right, I think we had 2 seconds there. Ms. Jacobs, pick your second. That sounds good. All right, any discussion? You did speak to the motion a little bit. This is great. Any questions or discussion from my colleagues?
Quick question. I don't know if anyone can answer. Given the governor's stay-at-home order, which extends through June 10th, has there been any consideration that we see renewed agreement for funds that go beyond April?
Mr.
I'm
Fries?
happy to say just a word to that. I don't know if our
Sure.
staff wants to speak first. Mr. Fries, please.
Yeah, I was saying at this time, I'm not aware. I am sure everyone understands the urgency of the issue at hand right now with the lost revenues. So I just don't know what else the state may be doing at this time. I know we've received this 1 month of revenue. We're hopeful that, given that this has been extended through June 10th, that potentially maybe there are some additional revenues that can be found.
All right, Ms. Crystal, you got some comments? Because I know you're
Yeah,
talking
the
with
only
Ms.
thing I would
Mitchell.
add is just from being in conversation with the executive director of the Northern Virginia Transportation Commission today. I know that there is optimism that the recently approved federal relief bill has support for transportation or transit in particular as well. I also know that we have been through that entity in relatively close touch with both DRPT and with some of the leadership of the General Assembly, which will apparently be convening on April 22nd. For a special budget session. So we've got a couple of, sorry, pardon the pun, vehicles to try to proceed or try to pursue additional relief, since we do anticipate that ART and other transit operators around the state are going to be taking a hit well beyond just 1 month's lost revenue.
Thank you. Any further questions? Discussion. All right. Our council has told me it's probably better if we do a roll call vote, so I will do it that way. So all in favor, please say aye, beginning with Ms. Crystal.
Aye.
Mr. DeFerranti.
Aye.
Mr. Dorsey.
Aye.
Ms. Garvey. Aye. Motion passes 4-0. Thank you all very much. Thank you, Mr. Freeze. Appreciate it. Thank you. That brings us to our next item. Are you able to call that item, Ms. Jacobs, zoning ordinance enforcement? I believe. I think
It's
that's
just a report. It's just a report.
It's just a report. I apologize. It wasn't clear to me on my list here. Thank you. We will move now to a report. And is Ms. Samia? Oh, a cat. That's a lovely cat. Is Ms. Bird going to give that, or are you, Mr. Manager?
What I'm going to do is I will give a summary of it, and Ms. Bird is on to answer any questions. So what I wanted to inform people about is, until such time as the governor's stay-at-home order is lifted, it's my intention that effective immediately, the zoning ordinance provisions and county board approved conditions associated with use permits and site plans will not be enforced for the following commercial, retail, restaurant, and food establishments or building uses. Let me go through that list. Drive-through facilities, food delivery service, groceries and food and beverages to off-site locations, parking lot and sidewalk sales associated with retail and restaurant establishments, provision of signs for retail and restaurant establishments on site indicating the availability of pickup, drive-through facilities, and food delivery service. And then finally, county board approved loading dock hours with special exception site plans and use permits. Each of these items will eventually be incorporated into the county board's continuity of operations ordinance. And we will continue to review these provisions and others. And I want everybody else to know, people to know that all the other zoning and ordinance regulations are still in force. And you can tell from each of these, this is meant to further enable the important delivery of food to our community and the provision of food and delivery services for our restaurant establishments, and to allow them to put signage that makes that clear to people who may be driving by. So that is the sum and substance, and happy to take any questions.
Thank you very much, Mr. Manager. Really appreciate this, trying to help us all get through this. Colleagues, questions for Mr. Schwartz? Seeing any. I know Ms. Bird is listening. Ms. Bird, was there anything you wish to add?
I have nothing to add. Thank you.
Okay, that's fine. Just wanted to check. All right. If there's nothing more, so no more questions right now. I think this is a great step, and it's just going to help both keep the businesses going and keep our people going. It's just common sense, and I'm so pleased that we're taking it relatively expeditiously. Thank you so much. If everyone is ready, I think now what we need to do is move into closed meeting, and I will make a motion. So I move that the county board convene in a closed meeting as authorized by Virginia Code sections 2.23711A1 and 8 for the following purposes. 1, personnel matter to discuss the performance and management plan of an appointee of the county board and consultation with the county attorney concerning the authority of the county board and the county manager during the pendency of the state and local emergency declarations and the actions that can be taken in response to the emergency and to protect the public health and safety and the public meeting requirements of the Freedom of Information Act that apply during the pendency of such emergencies, and consultation with the county attorney concerning the authority of the county board to adopt a continuity of operations ordinance in times of a disaster and the permitted scope of such an ordinance. Is there a second?
Second.
All right, thank you. Motion has been moved and seconded. All in favor, say aye, starting with Ms. Crystal.
Aye.
Mr. DeFerranti.
Aye.
Mr. Dorsey.
Aye.
Ms. Garvey, yeah, aye. All right, we are now in closed session. Thank you all very much.